department called Health Promotion and Resiliency. So what we do is we do a lot of different trainings and education sessions on mental health and developing resiliency. So specifically through the pandemic, we've had to adapt kind of the way that Jill and I deliver our usually in-person trainings to these virtual webinars, which brings us to why we're here with you today. So the next hour, we're going to talk specifically about mental health in older adults and really how to develop resiliency in that population as well. So with that, I'm going to turn over to Jill, who's going to bring you through the first half of the presentation, and then I'll be doing the second half. So we'll be doing a little tag teaming here.
Thanks, Allie. Samantha, could you give me permission to share my screen, please?
How do I do that?
You should be able to go into there.
We can see you.
In the chat function. There should be a co-host. You could be able to make me a co-host.
Okay.
If you see my name.
There we go.
What? Perfect. There we go. I always say technology is wonderful when it works. So thank you guys so much for having us today. We can also make this PowerPoint available to you afterwards. So one of the things that whenever Allie and I do a presentation, it doesn't matter who we are presenting to. We do a variety of different, like she said, but we always talk about what is exactly mental health, because that's kind of the foundation for all the work that we do. So the thing to remember with mental health is it's literally something that everybody has. If you have a brain, you have mental health. If you have a body, you have physical health. And we have both, so we have both. It's not something that kind of appears when you're 10 and disappears when you're like 60. It's something we have from the moment we're born. And it changes over time. Our mental health literally changes every day, sometimes multiple times in a day. And the other piece is it also significantly changes over time as we age. And there's a number of factors that play into that. Part of it is we're different people at different stages in our lives. We have different support networks. We have different things that are going on in our lives. We also have different things that are playing a part in our mental health. So the definition that you see here is from the Public Health Agency of Canada. And we like this definition because we think it's really kind of lets people know exactly what mental health really is. And it's the capacity of each and all of us to feel, think, and act in ways that enhance our ability to enjoy life and deal with the challenges we face. It is a positive sense of emotional and spiritual well-being that respects the importance of culture, equity, social justice, interconnections, and personal dignity. Why we like this so much is because it really does focus on the individual. And mental health really is all about the individual, just like your physical health is. There are definitely things that we need to keep in mind in general that help us to stay physically healthy, like food, nutrition, sleep, water, all of those things. And there's definitely things that help keep our mental health healthy. But again, everybody's going to be a little bit different. Like if we were all here to go to the gym, we're probably all going to do different exercises because we're all different people and we all have different things that we need to work on or need support in. There may be certain things that some of us cannot do, all of those types of things. And for centuries, literally centuries, we have tried to separate our mental health and our physical health, and you can't. The World Health Organization actually says there is no health without mental health. And your body and your brain work together. Your brain actually controls your entire body. So it's absolutely interconnected. And you've probably heard that term in recent years, positive mental health or positive mental well-being. What does that mean? It's about having a balance in life. And to be honest, figuring out that balance is a trick. It takes some work. And it's different for everybody because everybody has different things going on in their lives. You can have 5 people living in the same house, but they all have different things that are happening that affect that balance in their life. So it's important that we understand that there's a difference between mental health and mental illness. So the challenge is often to find ways to stay in balance and truly believe this is a learning process This is not something that all of a sudden somebody wakes up and goes, yes, I'm perfectly in balance and I know how to stay there. It really takes practice. And different challenges are facing us that affect this balance. Pandemic is definitely one of them. You've probably heard that saying, we're all in the same boat. Ali and I actually don't believe that. We believe we're all in the same pandemic ocean, but we're all in different boats. And our boats are varying sizes and equipment. Some of us might be in massive boats that can pretty much withstand anything. Some of other people might be in a canoe. Some might be in a raft with a paddle. And so having those things can have a definite different effect on each other. So when we talk about mental health and mental illness in older adults, it's really important that we look at things that are definitely myths that we hear about. So one thing that we used to think of, especially around anxiety and depression, we used to think that anxiety decreased with age. We used to think that as we age, we didn't have as much to worry about. So there was more physical issues, less psychiatric. Actually, the statistic for anxiety is the same. It doesn't matter what age. It's as common in older adults as it is in a 15-year-old. It's just different things that are causing that anxiety. The other thing that to remember is that when we talk about anxiety, everybody experiences anxiety. That's not an anxiety disorder. An anxiety disorder is when it is having a negative impact on your daily life. That anxiety has become overwhelming. It's hard to function. It's hard to have personal relationships because of those feelings of anxiety. And there's lots of different types of anxiety. And just because someone hits an age doesn't mean that that anxiety disappears. It's definitely it can still be a part of life. And depression is actually the opposite, because for years, everybody thought that depression was a normal part of aging, that the older you get, the more depressed you get. It's actually not. It is definitely not a normal part of aging. We know that 5 to 10% of older adults experience depression, but that number increases 30 to 40% for those who are in long-term care homes or hospitals. Part of that is situational change, right? There's different things going on in a person's life. But we also know that over 80% of older adults respond well to treatment. But it's interesting because 90% don't ever seek help. Why do you think that might be? Why do you think somebody who falls into this category might not seek help? Yes, tell me.
You're embarrassed.
Absolutely. Yep. Why else?
It may not be very high on the list of priorities above physical problems.
Yeah. Old way of thinking. This is my thought. The old way of thinking is, I can't talk about it. It's embarrassing and I can't talk about it. So therefore I'm going to pretend it's not happening.
Absolutely. And we know that stigma is actually extremely strong in older adults. We were raised to believe that, at least I know I was, that this was definitely not something we talked about. I grew up on a farm. So the theory was you worked hard, whatever would be, and everything was a phase and you would get through it. That was just kind of life. And we heard a lot about, you probably heard those statements, suck it up, pull up your bootstraps, this too shall pass. Well, depression and anxiety are actual illnesses in the brain. They're chemical imbalances. So they're not a choice. They're not an option. They're not a behavior. Nobody caused this. Nobody asked for it. And it can happen at any age. So just like diabetes can happen at any age, we can have heart problems at any age. We can have other physical problems at any age. But because there has been such a stigma surrounding an illness that occurs in the brain, we have been taught that this is something we don't talk about. And it really needs to be addressed, because we know that if 90% of people are not even seeking help, that's a lot of pain and suffering that doesn't need to occur. and that where treatments and different options are definitely available. So some of the things that we think about when we think about the challenges around older adults and mental illness, these are some of the things that happen. So social isolation, and that's why that number for those in long-term care homes or hospitals is a lot higher than those who may live on their own or with family. Functional decline, so not being able to do some of the things that one used to be able to do, right? We also hear about things like elder abuse and changes in one's life situation. Absolutely. And this could be a positive life change, but just because something is deemed as a positive life change doesn't mean it can be stressful for somebody.
Yes, no, I'm just listening to the singers.
We also know that there can be things like financial insecurity, and also things like elder abuse and substance abuse. So we often see substances can be abused in older adults, particularly alcohol, because alcohol is one that it's easily accessible. There isn't as much stigma around. It's often been a part of somebody's life for a long period of time, but definitely can be utilized without a lot of people finding out about it. Also, family caregiver stress and burnout. Sometimes in the older adult population, they're often looking after somebody else or maybe multiple family members. And that can really, really have an effect on our mental health. All of this is different stressors. And we know that stress has an effect on positive mental health, but it also definitely can have an effect when somebody's having a negative problem. So what are some of the challenges we've seen during the pandemic? Stress and anxiety can be overwhelming and definitely cause strong emotions in older adults. And again, this is something that none of us have seen before. A pandemic is something that is completely new. And just when Ali and I were sitting here hearing you talk about your challenges simply to get a vaccine, right? How simple that should be to be able to get vaccinated. And it's not. So there's a lot of things that are adding extra stress and anxiety. One, not being able to see family members. That we know that's been very, very hard on people. Both, it doesn't matter what age range actually, but a lot of our support systems can be not being able to utilize. You hear about individuals, who often are grandparents who look after their grandchildren who haven't been able to provide that support, or young adults who are caregivers for their older parents, and that hasn't been able to happen. So that stress and anxiety has been absolutely overwhelming. We also know that the impact on those with chronic disease or immune compromised systems, this has made this even more difficult and can cause even stronger reactions to stress when we're in a time of crisis. So the other thing that can happen too that also may play a part is that especially those in isolation or individuals who experience cognitive decline or dementia may experience more anxiety, anger, and stress because there's a lot of change happening. When change happens, our bodies respond, and our bodies respond in a number of ways. They respond emotionally, they respond mentally, but they also respond physically. So these are a lot of the things that can be compounded when there's a lot of change happening. The other thing that happens often with change and with right now is that lack of foresight. We don't have a lot of information about what the next 3 months is going to look like, let alone the next 2 weeks. As you guys know, the vaccine information is constantly changing. We never know if we're going to go back into a different zone. Are we going back to gray? Are we staying in red? Are we moving forward? And all of these things add fear and worry when we don't have accurate information. And then compound that with fear and worry about our loved ones. What we're seeing is a lot of change in people's sleep and eating habits. And that's in the older population as well. We hear a lot about people not being able to fall asleep, or when they do fall asleep, not being able to stay asleep. So, and we know how crucial sleep and proper nutrition are to our health, including our mental health. We also have seen an increased use of substances, and that can be tobacco, alcohol, or other substances, but in more the adult population, it is often more alcohol. So what are some things that we can do to kind of help ourselves during this and to help each other? So a couple of things is taking breaks from the news, reading or watching or listening to the news, because we know that, and we have studies that prove this, that repeated exposure to this pandemic can be upsetting and very stressful, and especially for vulnerable populations. But that's where our sources of information come from. So the other thing that we always talk about, and Ali and I are big advocates for that, is making sure that where you're getting your information from are accurate resources. It's a bit of, remember the old telephone game? Oh, I heard, and then it goes and it goes and it goes. This can happen, especially with information like this, if we're not using accurate resources. We're going to tell you about some of those accurate resources in a little bit. It's also really important to take care of your body, taking deep breaths and stretching daily, trying to eat healthy and balanced meals as much as possible, and trying to move your body. And that doesn't have to be like full-on strenuous exercise, but even Ali and I have talked about what sitting for a long time has done. Ali and I are both in very different physical shape and physical states. I had my hip replaced many, many years ago, and sitting for a long time causes me such extreme pain. So I have to make sure I get up, get moving, get doing things, because that position is very, very difficult. But other people are in different things, whereas sitting might be more conducive. But it's getting up and moving your body, because we know that also helps us with our mental health, because it changes the chemicals that are going through our brain. We need to find time to de-stress and unwind. And everybody might, you might hear from people, but that's all I do nothing. But that doesn't mean that you're relaxing. It doesn't mean that you're having fun. It doesn't mean that you're doing something you enjoy. And we always talk about connecting with each other. And this is hard. And I love the fact that we're doing a Zoom call with all of you today. And I hear you, technology is not always my friend either. But it definitely is a new way of connecting. But I think sometimes it goes back to the old-fashioned way, picking up the phone, having a phone call conversation with something, but talking with people who make you feel good, talking with people who actually will listen to your concerns and not just brush them off and say, oh, everybody feels this way. No, not everybody does. Everybody's feeling very differently right now. So it's nice to be able to have somebody to talk to about that. Connect with your healthcare provider if stress is getting in the way of your daily activities, especially if it's lasting several days in a row. If you're finding it's harder to get out of bed in the morning, if you're finding it's very, very difficult to function day to day, or to have impactful personal relationships, then you might need to reach out. And we're going to give you some options on that as well. Another good thing to think about during a pandemic is if you have an underlying health condition, and most pharmacies were doing this, making sure you had a minimum of a 2-week supply of medications that you're currently using. And use your support networks. And often pharmacies also will do delivery. And this is an important thing to do. A lot of different pharmacies do have different options with this. So it's really connecting with your pharmacy. And your pharmacy can also be a wealth of information when you can't maybe access your family doctor, especially about your medications and any interactions. Learning to do simple exercises that practice daily to increase or maintain mobility and reduce boredom. And it could be just as simple as getting out. My friend always says she works in the basement of her house. So she gets out and she does 3 laps around her backyard at lunchtime. She's got a big backyard. But for her, that's a routine that's working for her. It's an opportunity to get outside. I have 2 dogs. So after work, it's out for a walk with them so that we can get that fresh air in. And making a daily routine and sticking to it. A lot of times stress overload comes from feeling disorganized and out of sorts. So really paying attention to that. And remember that public health agencies are really trying to do the best that they can with the information that they have. And are often the best resource is actually going right to our public health department. And they do have a hotline if you have any questions. And we'll talk a little bit about that as well. Again, going outside, reaping the benefits of the sunlight that we have out there today. Ali said she was out on her lunch hour and it was pretty nice out there. So anything that we can get, definitely take as much as you can, even if it's just sitting on your back porch or front porch for a little bit. Utilizing your kitchen, checking out what's in your pantry and making a recipe. Maybe it's an old favorite. Maybe it's a favorite of somebody in the family, or looking for something new. That's definitely, the kitchen seems to be a place where I gravitate to. I like trying new things. Definitely baking's been a big thing for me. Finding a creative project you can do from inside your home. Allie can speak to this way better than I can. She's far more creative than I am, and crafty. But finding something that really is good for you. And it could also be organization, like just cleaning out a drawer or a closet can actually make us feel like we accomplished something. And tasks are a really good thing to not only keep our mind busy, but our body too. Find games to play on your phone, or card games, or even a table or a puzzle. Allie and I've talked quite a bit that both of us have taken up. Well, we like to play cards. They do board games. So it's about finding things, and it's kind of going back to things that we used to do as family, and friends that we're kind of engaging in again. And now I'm actually going to turn this over to Allie, and she's going to keep going from here. So Samantha, you might have to make Allie a co-host now as well.
Samantha.
Sorry, yeah, I'm working on that. I'm just trying to find you.
You might be able to now, Allie.
There we go.
I think I have it. Yeah. Let me just confirm if you guys can all see this.
Yeah.
Yep.
Okay, perfect. Thanks,
Okay.
Jill. Okay, so we're going to spend some time talking about resilience as we move through that second part of this presentation. And Jill gave you a lot of good ideas in terms of how to best kind of cope through this pandemic. So resilience is a big piece of that as well. So for those of you who are not familiar with the formal definition of resilience, this is kind of the one that we like to work with. It's from the American Psychological Association. And what it reads is, resilience is the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress, such as family and relationships problems, serious health problems, or workplace and financial stressors. It means bouncing back from difficult experiences. Okay, so we're going to spend some time talking about this. This is really important, really now more than ever, especially as we move through this pandemic, because our ability to rely on our resiliency skills really is about that, that skill set that we can develop to, again, bounce back from these difficult experiences. And resiliency isn't just, sucking something up or sucking, maybe different challenges or stressors that you're experiencing. It's not just sucking it up, it's acknowledging those. It's using the skill set that we're going to talk about to best navigate the challenges that we're experiencing and how to thrive through them, and really how to learn about how do we experience this, and how do we come back from this even stronger than before. So what's neat about resiliency too is that, it's not something that we're just necessarily born with, right? It's a skill set. And that means that's something that we can learn, but something that can also be learned at any age, right? It's not something that you just learn at when you're 5 or when you're 15 or when you're 20. People can learn and develop their resiliency skill sets at any age, maybe for the first time they're being introduced to this concept today, or maybe people have been working on this for several years, right? It's something that we can learn and really spend some time focusing on. And whether we're 5 or 20, we're 30, we're 70 or 90, right? It's really, resiliency really is, again, that skill set to help us best navigate some challenging times. So how do we build resiliency? So there's about 10 different, ways that we're going to go through this. Some of them, which Jill's already mentioned, but really kind of drawing in on them, is making connections is a big one, right? And we know that this might look a little bit different now through the pandemic, but those social connections are so important to building resiliency and are also our mental health as well, right? So it's those good and those positive relationships with close family members or close friends to you. And again, you might have to facilitate these connections a little bit different, right? We're not necessarily going to our favorite lunch spot, our favorite coffee shop anymore to meet face-to-face with our friends. So we've had to learn to adapt. How do we still maintain these connections, right? And here we all are sitting on Zoom video calls, which we never thought we would be at 2 years ago from now, or 2 years before this, right? So it's finding those new ways to still maintain those connections. Maybe it's picking up that phone, and going back to the phone calls, or maybe it's visiting friends, depending, on your comfort level and whatnot, to visiting friends at a distance at the end of your driveway, right? Those types of things are still so important to our ability to be resilient through all of this. Another big part of this is avoid seeing crises as insurmountable problems. And this is a big one because we know specifically now through a pandemic, it's really, really tough to not get wrapped up in all the negative information that we're being surrounded with all the time, right? And we can't change the fact that, you know, really stressful events are happening and things are changing every day, every hour. But what we do have control over is how we interpret and how do we respond to these events, right? Do we kind of get sucked into that negative talk, you know, and you know, or do we get focused on, you know, what's positive and what do we have going for us and what do we have control over, right? And that's what we do want to focus on, right? Is not catastrophizing everything. It's really just focusing, you know, on what do we have control on. And change is a part of living. That's a big one. Accepting that is huge, especially again right now through COVID. And again, if COVID's taught us anything, it's really that, right? We know that things are changing so rapidly, month to month, you know, week to week. You know, we never thought we'd be where we are, you know, a year ago, where we are today, right? Things are changing, and that's a big process, is to accept that. And especially with certain goals that we might have had, right? Those might have had to change, or they may have had to adapt or pivot a little bit, right? And that's a big part of this acceptance piece, is that, you know, these adverse situations and these times of uncertainty, they're happening to us, but our goals need to also change and be fluid with those as well, because that is really a part of the day-to-day life that we're living in now. And moving towards those goals too, right? That's a big one. So maybe you've had to change or adapt, you know, or modify those goals that you once had, but also it's taking steps to move towards those goals, right? It's maybe breaking them up into smaller little tasks. What can I do this week to move myself a little bit closer to that goal that I had? Or what can I do simply just today to move myself closer to that goal, right? It's developing goals that are realistic to what we're experiencing, right? And I can't tell you what that's going to be for yourself, because as Jill mentioned, we're all in a very different situation, right? But setting those goals and making sure they're realistic and then moving towards them is going to be a big piece of that resiliency. So next, when taking decisive actions, and I kind of just mentioned this, but when you are setting these goals, it's not enough just to set them, right, and hope that they happen, right? We actually have to take those decisive actions to choose what are we going to do today that's going to move us a little bit closer to that goal, right? So again, it could be breaking up that goal that you decide to set for yourself, to break it up into smaller pieces, and then deciding what can you do to move yourself a little bit closer. And looking for opportunities for self-discovery. That's a big one that's emerged through COVID. We know that people learn so much about themselves when they have had to go through a time of uncertainty or struggle, or have experienced a type of loss. A lot of the times people end up coming out of it discovering something new about themselves. Maybe they realize they're a little bit more resilient than they thought they were, or maybe they've had to adapt and change and learn a skill set or learn new way of doing their job, right? I know that's something Jill and I always talk about is, through this challenging time, we've had to completely adapt the way that we deliver our services, but it's also been an opportunity for self-discovery, right? You learn how to kind of pivot and adapt to the changing times that we're experiencing, right? So in the situation that you're in, are there any opportunities for self-discovery? Is there something that you can try that you maybe not have had the chance to try before? And maybe now's the time to do it. And nurturing a positive view of yourself, right? This is a really big one. Again, especially now as we kind of go through this COVID period time, because, a lot of the times we're really, really negative towards ourselves and we're really kind towards other people, right? We've heard it before, but how many times have people challenged you and asked you to really think about how do you speak to yourself? And is that the way you'd speak to your best friend, right? Probably not. So again, now as we kind of navigate this time of uncertainty, this is really important to be attentive to, because we really want to watch how we talk to ourselves. And if we're engaging in that negative self-talk day in and day out, it's going to have a pretty big impact on our mood, right? And a pretty big impact on our mental health. So really trying to be aware and giving yourself that same compassion that you give to other people, right? As we navigate this very new time, this is, as Jill said, it's not something that any of us have experienced before. And really trying to, engage in that positive self-talk is going to have a huge impact on your ability to be resilient through all this. And then another big one is keeping things in perspective. And I know this is easier said than done, but it is really a good reminder. You know, when we're faced with painful events, it's really easy to get kind of caught up in that stressful situation, right? But really trying to keep things in a long-term perspective, knowing that this is going to pass. I know it doesn't seem like it is. It seems like we're going to be in this forever, but we've had a lot of, you know, hopeful news coming out. Hopefully with this vaccine, we see some positive impacts in our community as well. But it's really trying to keep things in the long-term perspective, right? Because it's really, really easy to get wrapped up in everyday stressful events. And maintaining a hopeful outlook, right? It's again kind of challenging that way of thinking that we have. We know you've heard it before, but optimism enables us for good things to happen, right? When you look for the good things to happen in your life, and when you expect for good things to happen in your life, you will notice them more, right? And it's kind of like we always use the example of you want to paint your door red. You go for a walk. What do you notice? You notice all the doors in the neighborhood that are painted red, because that's what you're looking for, and that's what you're expecting to see and you're wanting to see, right? And it's kind of the same analogy with that optimism, right? When you expect good things to happen to you, and when you start to be more attentive to them, you're going to notice them. And that's what's going to also have a positive impact on your mood. And a big one too, and I know Jill mentioned this slightly as well, but taking care of yourself is really big in terms of building resiliency. You know, it's paying attention to your own needs, your own wants, your own feelings as well. And that's okay to maybe, you know, have a day or two that you're not feeling up to it. Today is not a good day, you know, and maybe you need to take a break from the different, you know, stressors or challenges that you're experiencing. But it's also spending that time doing things that are good for you. Right. And Jill talked about like getting enough sleep, getting proper nutrition, right? Or doing really activities that make you feel good, right? Whether it is crafting, whether it is walking, whether it is reading, right? It's also giving yourself that time and that attention to your own needs and feelings is going to have a big impact on your ability to navigate difficult times as well. So a couple of reminders when we, you know, leaving here today is really trying to focus on what's strong rather than what's wrong. You know, when we mention this, but it's really, really easy to get caught up in what's wrong, what's not working, especially every time you hear maybe a new announcement on the news, or maybe, you know, you've experienced a challenge. You always try and look at what's wrong and what's not working in that. And why did that cause me stress? And it doesn't mean ignoring that, you know, it just means doing it in moderating how much you do that, right? Not just getting all wrapped up in that. You can certainly acknowledge that, but also focus on what's strong, right? What worked really well in this, right? Or what did I learn from this? Or what positive did come out of this? Yeah, you know what, that was really stressful, but here's something that I learned about myself, right? And really, again, trying to focus on what's strong rather than what's wrong. And a big one that we've mentioned throughout this, right, is really knowing the difference between what you can change and what you cannot. And again, it's a simple reminder. You've probably all heard it 1,000 times, but it is a really important reminder, especially again, as we navigate this difficult time, right? There's a lot of things that are happening that are out of our control, right? Whether it's when the vaccinations come, whether it's where the numbers are at day to day, right? And what in that can you control? And that's really what we want to focus on, right? Is acknowledging that there is a difference, and it doesn't mean ignoring what you can't control, but it's also trying to focus your time and your attention and your efforts onto what is in your control, right? And a big one as well, another really great reminder is really, you know, we know that people are responding to this pandemic, but also with mental health, they respond very different ways, right? You can't always change other people's responses to events that we're experiencing, but you do have an effect, or you have the ability to change your own, okay? So doing what feels good for you. This is a big reminder. And we talked about it several times throughout this presentation, but we know that it has a huge impact on people's mental health. It has a huge impact, you know, we're here today to talk about older adults, but it has, you know, an impact on mental health across all age spans, right? So those simple reminders, keeping things in perspective, right? Practicing self-care. You know, I mentioned this, and really self-care is whatever makes you feel good. Again, it can be reading, it can be cooking, it can be walking, it can be calling a friend, right? Or maybe it's simply just having an extra cup of coffee or having an extra long shower today, right? Doing things that make you feel good. Bringing yourself back to the present, right? And people have so many different ways of doing this, but it's really easy to get lost in those intrusive thoughts that we all experience, right? Or those negative thoughts or those catastrophizing way of thinking. But bringing yourself back to the present can be really, really helpful in terms of improving your mental health as well. And Jill talked about this one, right? But limiting that news consumption is huge. We are surrounded all day long, whether it's news, radio, phones, with information that's, highly stressful for a lot of people, right? So really trying to acknowledge how much of that we're consuming a day is so important, right? It doesn't mean you can't be informed, but we also don't want to be swarmed with it day in and day out, right? Seeking reliable information only, right? And Jill mentioned this, right? It's so easy to get caught up in hearsay from people or, those online chat groups or information. But as she said, with telephone, things get so misconstrued. So really trying to fact check, go back to Health Canada, go back to your local public health unit, and really trying to get information from reliable sources. And we talked about this as well, but setting reasonable goals for yourself every day is huge, right? And for some people, it might be writing this down, or maybe for some people, it's saying them out loud, right? But setting those goals for yourself every day, especially now as our lives have changed so much, and picking those goals day to day or week to week, or what's your goal next month, right? Whatever that may be for yourself. And this is the fun one as well, is make a to-done list instead of a to-do list, right? We all sit there at the beginning of the day, we make this long to-do list, but sometimes that can be overwhelming, or sometimes that can cause people stress. So instead, let's flip that way of thinking. At the end of your day, maybe make a to-done list, right? Write down all those things that you accomplished today. Take a look at that list and say, hey, you know what? I had a really great day today. Look at all the things I accomplished. Or maybe you only got 2 of those things done, and that's okay. It's also allowing yourself to have a day too. Maybe today wasn't your best day, and that's okay, right? And certainly if you're struggling in any way whatsoever, we encourage you always to reach out, because we know that there is help available, and that treatment is possible. And you might be supporting somebody else who is struggling with their mental health through this pandemic as well, whether it's somebody else or yourself. We do want to share some of these resources with you just so that you are aware of what we have available in our community. So our 2 crisis resources that we have available are Coast and Barrett Center. So you might be familiar with some of these, but Coast is our crisis outreach and support team, and they have a team for youth, adults, and seniors as well. And they have a 24-hour phone number that you can call that provides crisis support over the phone, and should need be, and they determine it's necessary, they also can do outreach as well. Again, depending on the situation. Barrett Center is another crisis resource that we have in our community. So it's a community-based short-term crisis stay. So not only do they have the crisis phone number you can call if somebody was in crisis and needed a safe place to stay, and assuming they had room to do so, they do have actual crisis beds that somebody can stay at for a short-term period in hopes of transitioning them back into the community. Jill and I are both from, as we said, the Canadian Mental Health Association, which is CMHA that you see up there. But we do have, you're certainly welcome to call our office if you have any questions. We have somebody, we're not crisis, but we do have somebody available for the phone between 8 till 4:30 who can answer questions about maybe navigating the different programs and services that we have available in the Hamilton region. But also our website has a lot more information beyond that has support tips, it has resources, it has upcoming presentations and whatnot. Another really great resource that is available to people in Ontario, specifically those who are struggling with feelings of anxiety or depression, is Bounce Back Ontario. And it's a program that is free to those over the age of 15, but it is a cognitive behavioral therapy based program. So it's a skill-based program for individuals, again, who are struggling with anxiety or depression, who need some assistance that way. And it's kind of like a gym coach. You get a coach, a Bounce Back coach paired with you, and you will actually work your way through certain workbooks that get sent to your house or they get sent to you digitally, and your coach will actually work with you to help kind of progress you through the program itself. And it's had tremendous success on people's mood and anxiety as well. So it's a really great resource. You can do self-referral. They have a website there as well that you can access that way. That's available. So with that, Jill and I are going to actually open it up to questions. Just watching time here. We have about 10 minutes for questions. So if anybody does have anything, they're more than welcome to, you can unmute yourself or you're welcome to pop it in the chat and Jill and I will do our best to answer that for you.
Okay, you're gonna give us an email because I would love a copy of that today.
Yeah.
There's 2 people that I want to send it to very, very badly.
Yeah, for sure. Are you talking about the slideshow or
The whole yeah, the
Yes.
whole show.
Okay, for sure. Yeah, I'll definitely send that to Samantha. Actually, I'll do that right now so that you have
Okay,
that
thank
available.
you. Dollarama has lovely coloring books and all kinds of stuff. I'm an artist and I really like doing that. So I go in there and get a lot of art supplies. There's been a resurgence of adult coloring,
Yes,
which is
there
sort of
has.
in right now. So they have that, they've got puzzles, they've got all kinds of stuff. Go into Dollarama, you'd be surprised.
Yeah, they really do. Every time I go in there, I'm surprised with more stock.
Go
that
in
they
for
have.
one thing, end up with 10 or 20.
I am right there with you. I
Yep.
do the same thing.
Well, thank you guys for having us today. We really appreciate it.
Thank
Thank-
you.
Thank you very much
This
to
was
Allie
awesome.
and Jill for joining us today. This has been a wonderful webinar, and we really appreciate your time.
Perfect.
Thank
I
you.
just sent you over the PDF slides, Samantha, so please feel free to share them with anyone who attended today.
Okay, thank you. All
Thank
Thank
you, everybody. Take
you.
care.
right, have a great day.
Bye.
Bye.
Okay,
Bye.
we're done?
We're done.